In this video, I'll be discussing about the importance on improving our core strength without any downward pressure, as well as if you're suffering with a rib cage flare, which means an overexpanded rib cage because of pregnancy. It happens when you have increased anterior lordosis, which is overarching of your low back because of the pressure of the baby in the anterior portion on the front part of your pelvic floor. Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. In this video, we're going to try to target our core muscles without any downward pressure to our pelvic floor that could create prolapse symptoms. So what is prolapse? Prolapse is a bulging, egg-like sensation on your vaginal canal that could create leakage, pain during intimacy, like you feel like deep penetrating pain during sex. Thirdly, you can also have some bowel obstruction that could cause constipation because the colon creates a banana shape at the lower part of your descending colon. So if you have anterior pelvic tilt, sometimes it feels like it pushes to your vaginal canal. So the emptying of your bowel, you ended up splinting. So what is splinting? Splinting is when you use your finger into your vaginal canal to push through the back wall of your pelvic floor so that you can fully empty. So those are the things that could happen if you have prolapse. So what is prolapse? Why it's happening? So it's common for postpartum. During pregnancy, you could start having that downward pressure because the baby is pushing down to your pelvic floor. Thirdly, perimenopause, menopausal women, we are losing estrogen. Do you know that when you turn 30 years old, you only have 25% eggs left? And those ovary eggs, every time you have ovulation, it secretes estrogen. And then when you turn 40 years old, you only have 1% eggs left. So it's not a lot of eggs in our lifetime. I know it's unfair, but that's part of our reproductive system. So when you're losing eggs, we have less estrogen in our body, and estrogen is our strength. It gives strength on our pelvic floor. It keeps our hair, skin, and nails look lovely. It decreases inflammation. It keeps our brain sharp. That's why there's brain fog happening. And it also keeps our bone strength healthy to prevent osteopenia and osteoporosis. So if you're suffering from weakening of your bones, weakening of your muscles, that's why there's HRT, hormone replacement therapy. However, despite taking hormone replacement therapy through patches, pills, it's not the only way to strengthen the pelvic floor. I believe on estrase cream, estrogen cream that's suppository. The good news about it, it removes the black box that could cause cancer on their body. I even have patients with breast cancer who's taking estrogen cream to keep our pelvic floor healthy. So where else in our body we secrete our estrogen? There's actually estradiol. Estradiol is a different form of estrogen that secretes from on top of our kidneys, the adrenal glands. So what is adrenal glands? Adrenal glands is a gland that secretes hormones, different types of hormones, such as cortisol, estradiol. And if you are in high stress mode, if you're very stressed, you started having more cortisol in your body. Cortisol is actually healthy. It becomes unhealthy when it's too much. Usually, without cortisol, it's hard to wake up in the morning. It warms up our body. So that's why there's a time clock. In the morning, you start waking up, maybe for me, 6 a.m. But I don't need an alarm clock. My body wakes me up. The cortisol slowly rising, and it peaks usually 10 a.m. So that's why it's best to exercise in the morning. And then it slowly dips down in the afternoon. However, if you're still very stressed in the afternoon and you're spiking your cortisol, it's best to listen to your body. We need to slowly lower the cortisol in the afternoon. Listen to your body. Have the serotonin should be slowly climbing up. Serotonin is a hormone that makes your body to relax. So that's why it's best to put stress on your body, but not to the point your cortisol is going up. So that's why in this video, it's gravity assisted. We're gonna use a very soft foam roller. So if you need a foam roller, comment foam right now, FOAM, and you can access my very soft foam roller. This is 3 inches. It's a little bit elevated when the diameter is 3 inches, and it's 36 inches length. It's very soft, so it makes yourself become more consistent on your workout. When you have a very hard foam roller, guess what? You're not gonna work out. You're gonna have aches and pain on your joints and your hips, especially you're low in estrogen. Why do we need gravity assisted? My patients always ask me and my clients, why do we need it? Because when you're weak in your pelvic floor, it starts going down, right? Sometimes it gets tight and lifted. So that's why Kegels alone is not the answer. We need to learn how to do reverse Kegel. So in this video, we're also going to do some bulging and reverse Kegel with the gravity assisted. So it's not too much downward pressure. We need gravity to help us. So if you have time in your day, my best recommendation is to elevate your pelvis. You can use prop-up pillows or yoga plow. Yoga plow is you use the wall, place your hips and your buttocks, your vaginal canals pointing to the heavens. So you're using the gravity to help you lift your pelvic floor. Together with our exercises, it helps lift. That's why sit-up, ab crunches are the worst thing on your pelvic floor. It creates a downward pressure. We can strengthen our core without doing those exercises. So big no-no, red flag on our pelvic floor. So that's why we need some gravity assisted. There's also a 6-inch foam roller in my program, Comet Foam, FOAM, and get the link of the 3 or 6-inch foam rollers. It's limited supply. If you need to access them now, get them right now while still have some supply left. And we're gonna use some dumbbells. If you don't have dumbbells, you can use bottled water or you can just use your hands. Or you can use a rolled blanket. If you don't have a foam roller, you can still join me. So my best recommendation is to do yoga plow or gravity assisted even 5 to 10 minutes every day. Once you wake up in the morning, use the restroom, pee first, lie down, elevate your pelvic floor. Place this on your pelvis, not on your lumbar spine, not on your hamstrings. Do this every single morning. Usually we are the strongest in the morning, and that's why do this as well in the afternoon. If you've been standing all day, sitting all day, driving all day, running around, gravity assisted, 5 to 10 minutes. I also recommend do this gravity assisted after bowel movement. If you're straining while pooping because of constipation, that's why 30 to 40 grams of fiber is very important. Having some more fluids in your diet so the water goes to your colon to help you poop. And don't strain. Try to make sure you have a squatty potty so you can sit down in a relaxed state. Do you know that pooping should be just plopping and relaxing? There should be no phone. Your underwear should be all the way to your ankles. Knees open, like open the gate. Rock back and forth first to help you wiggle the poop out. Slightly lean forward, don't lean back. Take a deep breath. Push your belly out as you breathe out to engage your pelvic floor. So as I breathe out, I'm pushing my belly out. That opens your gate. So you're not straining your pelvic floor. So you're not pushing out things that's not appropriate, such as your urethra, your bladder, or your colon. My last recommendation, do this gravity assisted also after sex. So after sex, sometimes with pelvic floor weakness, you feel weaker. It's like a workout, right? So it's best to help your prolapse symptoms. And also I recommend if you feel like something hitting you on your canal, guess what? I always recommend my patients to prop up some pillows during sex if you are doing missionary position, and that will help prevent the downward. Your gravity is helping your collapsing pelvic floor, especially the anterior portion, which is the front part where your bladder or your urethra is hanging low. So with the gravity assisted, use that pillows or foam roller during sex, guess what? There's less pain. If the pain is more than 4/10 pain scale, stop. Don't make the pelvic floor worsen by keep pushing it and could cause pain after sex, bleeding sometimes. Listen to your body. Give your partner some signals when it's time to slow down, keep on going, or stop. Anything more than 4/10 pain, you should stop because it's gonna make your pelvic floor weaker. Okay, those are my recommendations for today before we proceed the program. So we're gonna lie down on your back, place the foam roller underneath your pelvis. And then grab the foam roller. Take a deep breath. Lift your hips up. And then press up with the dumbbells. We will need to warm up our pelvic floor by taking a deep breath through your nose. Remember, the pelvic floor and diaphragm dances together like a canister motion. As you inhale, I'm going to expand my abdominal muscles. You can see my abs go up. As I breathe in through your nose, gently stretching our pelvic floor. As you exhale, zip it up like a tight jean from your lower abs to your navel so it prevents that downward pressure. I'm keeping my lips small opening, not open wide. We want to engage our pelvic floor by pursing our lips. You can also use a straw in your mouth and exhale. The longer the straw, the more engagement. You can also use balloons, or if it's too challenging, cut the straw in half or in a third. I want to make sure you're not straining by holding breath. Holding breath creates downward pressure in your pelvic floor. Once in a while of holding breath is fine, but multiple times of holding breath, and if you lift heavy weights and you're holding breath, you create that prolapse symptoms. Okay, my friends, press up now. Take a deep breath. Exhale, breathe out. You can see my abs are tightening. Inhale, expand. Exhale, zip it up. Last one, inhale. Exhale, zip it up. Well done. Now, we are warming up our core by slowly doing gentle tabletop. So tabletop is when you keep your knees bent to 90 degrees as you breathe out. Lifting it like supine marches. Inhale down, expand your belly. Exhale, zip it up and switch to the other side and exhale. Breathe in, slowly go down. Exhale, switch. 4 more. Breathe in, keeping the dumbbells pressing up, so that helps engage your deeper core muscles. Breathe in, breathe out, zip it up. 2 more. Breathe in, breathe out. Last one. Well done. Now we're going to lift both legs up to double tabletop. As you breathe in, breathe out slowly. Tap one foot down. So this is reverse tabletop. So I'm tapping one as I breathe out. Inhale as I go back to double tabletop. Breathe in, breathe out. Inhale, exhale. Don't forget the zipping up. Prevent that downward pressure from your lower abs to your navel with your breath work. 4 more. Inhale up, exhale down, switch. 3 more. Two more. Inhale, exhale. Last one. Well done. Now we're going to challenge by slowly extending one leg up as you breathe out to lengthen your hamstrings. Your hamstrings origin is on your sitting bone. So if you're sitting a lot, it creates downward pressure in your pelvic floor. So strengthening and lengthening of your hamstring is so crucial to keep your pelvic floor health. Breathe in back to tabletop. Exhale, extend. Inhale. So we're still warming up. Slow and steady. Mindfulness. Breathe in, breathe out, extend. Squeezing your core in from your lower abs to your navel for that dancing motion with your diaphragm and your pelvic floor. 2 more. Breathe in, breathe out. Last set. Well done. Now we're going to do dead bug. Dead bug is one of my favorites. As you lower your right foot down, keeping that knee bent to 90, I'm lifting my arm overhead, opposite arm. So as I lower my right foot, my left arm overhead as I breathe out. Breathe in as I go back center. Ease center control. Slowly go down. Tap gently. Breathe in. Breathe out. Inhale. Exhale. 4 more. Inhale, exhale. 3 more. You can hear my breath work. I'm really mindful. Zipping up motion. Last set. Well done. Now, with our legs up pointing to the heavens, we are keeping that gravity assisted. As I said, yoga plow is one of my best exercise. So just keeping my toes up, I'm using gravity to help my prolapse. If you have prolapse. I don't have prolapse, thank God. I've been doing this for many years already. From my postpartum depression, postpartum weakness, gaining 75 pounds, and now look at me. Keeping my core healthy, no more leakage, no more pain during intimacy. Even though I was only 25 years old, I was having a lot of symptoms from my tailbone injury from snowboarding. So the tailbone is where the most muscles of our pelvic floor attaches. So if you're having pelvic pain, having coccyx pain, which is the tailbone, then this is a great program for you. If you have coccydynia, which is inflammation on your coccyx. Okay, I'm going non-stop again about science, about anatomy as a physical therapist and pelvic floor therapist, Pilates instructor. I want to make sure you understand where I'm coming from, why I'm giving these exercises. So while I'm talking about it, I'm letting the gravity pointing up, de-stress the nervous system, the vagus nerve, the fight and flight response. Always remember, the anxiety, depression causes more pelvic floor issues. So our mental health is so important. Taking deep breaths help regulate our nervous system, as well as the vagus nerve, the vagal release. Okay, my friends. Now, we're going to do double leg circles. Slow circle, clockwise and counterclockwise. Take a deep breath. Inhale, exhale. Slow and steady. Don't rock your hips. Slow, controlled. Now, reverse circles 10 times. Take a deep breath. Exhale. Zip it up. Don't forget the breath work. 5, 4, 3, 2, and 1. Now, we're going to slowly lower one leg down. As I lower the dumbbells towards my chest as well, like a chest press, hugging it to my chest as I lower down my foot one, while the other one's pointing to the heavens. As I breathe in, breathe out, lift the dumbbells and lift my foot up. Now I'm going to switch to the other side, lower my right foot, keeping my knee locked. Dumbbells to my chest, I breathe in, and then breathe out. 4 more. Feels so good, lengthening and strengthening all at the same time. Inhale, exhale. 3 more. So I'm pressing as I exhale, inhale as I go down, slow controlled, exhale as I press up, as I exert effort. 2 more. Last set. And last one on my right. Well done. Now I'm going to do V-stretch. V-stretch is one of my favorites. Place the dumbbells locked together from here. Internal rotation of your thumbs. And then as you breathe in, I'm going to slowly lower both legs out to the side and my dumbbells out to the side. And then once I open to a V-stretch as much as I can, dorsiflex your ankle for a deeper stretch. Exhale, back center. Your hip adductors are the mirror of the pelvic floor. Toes pointing to the heavens again as you go back to the center. As you breathe in, breathe out, open. Dorsiflex. Exhale. Tippy toes. As I breathe in, breathe out, open. Dorsiflex. Exhale, back center. Inhale. Exhale. Dorsiflex. 4 more. 3 more. 2 more, my friends. Last set. Now we're gonna do double leg raises, eccentric control. As I lower my feet down, heels together, toes apart. As I breathe in, slowly lower my feet down, arms overhead, exhale. Inhale as you go down as much as you can, a few inches off the mat. Exhale, lift. Breathe in, breathe out. Inhale, exhale, lift. So if you want to join my 8-week challenge, I just opened the program today. Comment flourish, Flourish, or comment join, JOIN, And you can access the program today. Plus, there's a 20% discount for spring. So comment join right now and you receive the discount code inside your DM. Inhale, exhale. So don't miss out before the discount code expires. Breathe in, breathe out. Breathe in, breathe out. Last set, inhale, exhale down. So comment join right now, JOIN. Join the 8-week challenge this spring. Comment flourish as well and get the 20% off. Last one, slow control. Well done. Now we're gonna let go of the dumbbells and let go of the foam roller. We're gonna place the foam roller underneath your hip flexors. Most of my patients with pelvic floor weakness, they're very tight on the anterior portion as well. Because this is only 3 inches, it's a gentle release on the front part of your pelvic floor. So always remember, there could be tight and tugging in the front of your pelvic floor or the back end. So as you bend your right knee, you turn your head to the right and breathe out. Inhale, back center, and then switch to the other side. Inhale, exhale. We're gonna strengthen our gluteal muscles. The stronger your butt, the stronger your pelvic floor. We're not doing squats yet because if you have prolapse, squat is aggressive. So this is a gentle program to slowly progress. I allow my patients to go squatting once there's no more egg-like sensation on their pelvic floor. When they're standing a lot for 30 minutes, they started feeling it, especially at the end of the day or after bowel movement. Last set. Breathe in and breathe out. Now, we're gonna target our glutes. With your knee bent, toes pointing to the heavens, mindfulness. You wanna make sure you're mindful on lifting as you breathe out. So the foam roller helps assist on the weakness of your glutes. Inhale down, exhale lift. Breathe in, breathe out. Inhale, exhale. 4 more. 3. Feels good on your hips, on your back. If there's a deep ache, as long as it's not excruciating pain, continue. It's just some muscles need to be moved and activated. Now switch to the other side. Bend your left knee, toes pointing to the heavens. As you breathe in, breathe out, lift. Inhale down, exhale, lift. 4 more. 3, 2, and 1. We are progressing. If this is too challenging, then continue with single leg, with both legs up now, bent, and then lift up. So if this is harder on your back or your glutes, put your head down as you breathe out and lift. Inhale down, slow and steady, don't plop. Inhale down, exhale, lift. If you're having hip groin pain, stop, or pubic pain. It should be just a gentle release. It means it's too aggressive on your weak core. Last one. Well done. Now we're gonna separate our feet apart with your knees together. We're gonna do internal rotation. So internal rotation of your pelvic floor opens up the posterior chain of your pelvic floor. So what I'm talking about, there's the back end of the basin of our pelvic floor and there's the front end. So take a deep breath. Exhale as you open. It's important to stretch it out. You can also progress by placing elastic band around your ankles and open. Breathe in, breathe out. So we're targeting the posterior chain, and then later we're going to target the anterior chain by doing external rotation. So internal and external rotation of your hip joint is so important to our pelvic floor health. Last one. Well done. Now, we're gonna challenge further by doing swimming. You can grab your dumbbells if you wanna challenge your posterior chain muscles. Always remember, if you have rib flare, it's because you have forward head, rounded shoulder posture, breastfeeding, doing computer work and everything. So this is 5-pound dumbbells I'm holding. If it's too challenging, then lower it down. So as I lift my right leg up with my knee straight, I'm lifting my left dumbbells as I breathe out. It's like swimming. And then switch to the other side, right arm, and then left foot up, breathe out. Inhale, exhale, switch. If there's neck pain, stop. You want to make sure you can handle the weight on your upper body. 4 more. 3. 2. And 1. Now, we are further progressing by doing a W position, which means my arms into W, pulling my elbows to my waist with the dumbbells, while at the same time bending my knees. So take a deep breath, exhale, lift. Inhale, down, exhale, lift. 4 more. Extend your elbows, extend your knees, exhale, lift. 2 more. Last one. Woo. The posterior chain muscles. It's a challenge, especially if you don't really target those muscles. You know, the forward lifestyle posture, being in your computer, on your cell phone, is important to strengthen the back end so you don't have that round the shoulder posture, kyphosis, or text neck. Okay, my friends, we're cooling down now. Grab the foam rollers in your hands. We're gonna do cat and camel, knees level to your hips. Round your shoulder to an angry cat as you breathe in. Breathe out, look up. And arch your back. Breathe in, round. Feels so good. Exhale, lift up. 4 more. Inhale. Exhale. 3 more. 2. And 1. Well done. Now we're going to extend one leg up for a kick back. Strengthen your glutes and lift small pulses. 10, 9, 8, 7. Strengthen your glutes, your core. 3, 2, 1. And then rainbow. Tap the outside of your mat and then up and around like a wiper, like a rainbow. And then to the other side of the mat as you breathe out. Inhale, keeping your core engaged. Exhale, out and then in. 4 more. Breathe in, don't forget your breath work. 2 more. Last one. Well done. Now switch to the other side. Lift and pulse. 10. Keep your back engaged. Don't overarch your spine. 7, 6, 5, 4, 3, 2, 1. And rainbow. In and out. Breathe in and breathe out. 4 more. Don't forget your breath work. 3, 2, and 1. Woo! Well done. Now, open your knees out to frog stretch. Feet together, knees out, outside of the mat, and then child pose and stretch. Take a deep breath and then roll up to sitting. Roll the foam roller closer to you. This helps open external rotation, targeting the anterior portion of your pelvic floor. The groin, the obturator internus, stretching them out. Roll down, breathe in and breathe out. If you want to join my 8-week challenge, come and join right now. And I'll guide you through with the bowel bladder diary. I want to know what you're eating and drinking that affects your pelvic floor, that could cause spasming. And that's why no matter how much you exercise, if you're having a lot of irritants or things that you're eating that makes your bladder spasm, I'll do a proper assessment with you. Whew, last set. And then we're gonna knees together, grab the foam roller in your hands, hands level to your shoulders, grab the mat with your toes for a downward dog. As you breathe in, breathe out, lift your knees up and hips pointing to the heaven. So this is great for prolapse. March left and right. As you breathe in and breathe out. And stretch those posterior chain, your hamstring muscles, your spine. Let the gravity help you as well to strengthen your prolapse symptoms. Okay, my friends, and that's it. I'm hoping you enjoyed this lovely video learning about prolapse symptoms, learning about how to strengthen it safely and effectively. If you want to learn more about Pilates, yoga, physical therapy, please subscribe to my channel. You can check out my YouTube channel. Ring the bell so you won't miss anything. Like and share this video. Every like you're giving to my channel, you are supporting me. And if you want to join my 8-week challenge, join today. Just comment join, JOIN. I'll send you the link directly to your email DM. If you have more time today, I have a video about core back immersion therapy over here, and learn about proper breath work over here. Until next time, always remember, be safe, be well, and healthy you. Bye!